Every year, in the quiet hours of countless shelters, a tragedy plays out. Millions of healthy, loving dogs and cats are euthanized. Their lives ended not because they are sick, but because they're unwanted. The sheer mathematics of pet overpopulation is a moral stain on our society. The solution seems simple: mandatory spay and neuter laws. It's a surgical fix for a social disease. But what if that simple fix is an invasion of privacy? A government overreach that penalizes responsible pet owners? What if the same procedure hailed as a lifesaver also comes with serious long-term health risks? Tonight, we ask the question that divides the entire animal welfare community. Should the government have the right to decide what happens to your pet's body? For advocates of mandatory laws, the argument is brutally simple. We have a crisis, and crisis calls for action. Look at the numbers. While rates have thankfully declined over the decades, conservative estimates still suggest millions of companion animals enter U.S. shelters annually, and hundreds of thousands are euthanized. The problem is simple geometry. One unaltered female dog and her offspring can potentially produce tens of thousands of puppies in just 6 years. One can produce a staggering number in 7. This is not about opinion, it's exponential math. Mandatory spay and neuter, MSN, is the only reliable way to slow the flow of unwanted animals and alleviate the financial burden on communities that spend millions on animal control. It promotes the greater good by ensuring only responsible, licensed breeders or those with specific medically necessary exemptions are contributing to the gene pool. For the animal itself, it offers definitive health benefits. Spaying virtually eliminates the risk of pyometra, a life-threatening uterine infection, and drastically reduces the risk of mammary cancer in females. Neutering eliminates testicular cancer in males. The law is a lifeline for shelter pets and a shield for the individual pet's health.
The opposition calls MSN laws a misguided attempt to penalize the many for the sins of the few. They argue that these laws don't target illegal backyard breeders, they target law-abiding citizens, and, most critically, the poor. When the cost of surgery becomes a mandatory government fee, it has dramatic unintended consequences. Studies show that the primary barrier to spay-neuter is cost. When a community, such as one in the past in Fort Worth, Texas, implemented a strict spay or pay program, they saw a concerning drop in rabies vaccination compliance. Why? Because financially struggling owners, desperate to avoid the high fines for an intact pet, stopped taking their animals to the vet altogether, literally going underground. This creates a public health risk, not an animal welfare solution. Furthermore, the idea of universal sterilization is being challenged by modern veterinary medicine. Recent complex studies from institutions like UCdavis have shown that in some specific large dog breeds, especially those sterilized before sexual maturity, there is a statistically increased risk for certain joint disorders like hip dysplasia and specific aggressive cancers like hemangiosarcoma or osteosarcoma. This forces responsible owners and their vets into a complex, nuanced decision that an inflexible law cannot accommodate. The opponent's core argument is this: the decision is a complex medical one that belongs in the hands of a pet owner and their veterinarian, not a city council. History shows that mandatory laws are far from a silver bullet. Their outcome depends heavily on local context and enforcement. Take the example of Los Angeles County, California. LA County is a massive area with a long history of pet overpopulation. In 2008, a widespread mandatory spay-neuter ordinance was passed with the intent to empty the shelters. However, critics noted that in the years following, while shelter euthanasia rates did continue a pre-existing decline, the law was not a clear driver of change. They argue a key reason was lack of enforcement and accessibility. irresponsible breeders simply ignored the law, and low-income owners unable to afford the initial high veterinary cost or the city fine faced increased financial distress, which often leads to the very thing the law was designed to prevent: relinquishment to the shelter. Many organizations now suggest that the resources spent on enforcing the mandate would have been better used funding free or low-cost spay-neuter clinics directly in underserved communities. Contrast this with the approach in Buncombe County, North Carolina. Instead of a blanket mandate, they adopted an incentive-based approach known as intact animal fees. Pet owners must purchase an annual high-cost unaltered animal permit if their pet is over 6 months of age. The significant fee is waived if the owner presents proof of spay-neuter. This is often viewed as a middle ground. It respects the right of ownership while heavily incentivizing the desired behavior. Data suggested this approach, combined with aggressive education, led to a more promising decline in euthanasia rates and increased shelter-based spay-neuter efforts without the punitive measures of immediate fines or impoundment.
So where does the truth lie? Is mandatory spay-neuter the necessary ethical hammer to end mass euthanasia? Or is it an ineffective, ill-conceived piece of legislation that punishes the responsible while failing to address the core problems of poverty and owner irresponsibility? The stakes are immense. On one side, the freedom of a responsible owner to make complex medical choices for their pet. On the other, the desperate plight of the millions of animals who will die this year because of simple, preventable reproduction. The debate over this single surgery is not just about animal population control. It's about the very definition of responsible pet ownership and who gets to decide what that means.